Okay, ladies and gentlemen, this is another episode of The Controversial Room. I remain your humble host, Prince Ewuzie. Right beside me, we have Amah.T.Amah, and of course, the doctor is still in the building. I would love them to introduce themselves, starting from Amah.T.Amah. I would love you to, greet the audience.
They've known me already, but it feels good to be back in the studio over a long period of time, and I ask you to stay tuned and hear us out.
Yeah, it's been a long time actually. I don't know, how has it been?
Well, my brother, man and things are doing.
All right, Dr. Victor, good to have you back.
Yes, it's so nice to be back on this wonderful platform. And I know for sure today's is going to be very, very good. So just stay tuned.
All right. Before we dive in the topic of the day, still our request, you have to hit the subscribe button and also hit the notification bell for you to receive our updates. And we want to thank you, our viewers, for also engaging on our videos. It's something encouraging. All right. Today we have an interesting topic, Dr. Victor and Mr. Amah.T.Amah. So we have an interesting topic. We want to look into this topic, ulcer. People have a misconception about ulcer. Do you get? And I would love you, Dr. Victor, to direct our mind, teach us on how to handle ulcer and the misconception we all have been having when it comes to ulcer. So.
All right. Thank you so much for this wonderful topic that has been presented in this particular platform. When you hear the word ulcer, I can tell you for sure, 90% of Nigerians will agree that they have ulcer, even when they don't have it. Oh. So anytime maybe someone has a lower abdominal pain or that's maybe heartburn, the first thing that comes to their mind is, I have ulcer. And you hear some people saying, I've been having ulcer since childhood. You understand? So ulcer is something that is very, very common in our country, even when the person involved does not even have it. You understand? So, but thank God today, the misconception behind ulcer will be clarified today.
Yeah, thank God.
So, to start with, we are going to try as much as possible to break this concept right down. Okay. What's an ulcer, like the layman term? Because normally, medically, what we call this disease is PUD. Peptic ulcer disease. You understand? Right. And this peptic ulcer disease is divided into two. You understand? We have the gastric ulcer and we have the duodenal ulcer. So in general, so peptic ulcer is any ulcer you get in the stomach and in the intestine, the small intestine, mainly the first part of the small intestine. You understand? So, but basically, what an ulcer simply means, it's just like a wound. So when you have a wound in the stomach or in the small intestine or the duodenum, that's what we call ulcer in the layman term.
Okay.
So just like a wound. Like if this is a skin and you have a wound there, you understand? So that is basically what's actually going on. You understand? But this ulcer, we really need to understand what causes it.
Yeah.
You get? Before you go talk about management,
yes,
you need to know what causes this particular ulcer. Now, there's a lot of misconception behind these causes.
People do say,
yes, thank you. That is the first one. Please, for the 100 times, hunger does not cause ulcer.
Wow.
Do you get that? Hunger does not cause ulcer. You see some people saying, I'm having ulcer. Why are you having ulcer? I don't used to eat, to hardly eat. I miss my food. It's not true.
But most people have kind of, when people that has ulcer, if you check their history, you find out that these people has been skipping their meals and stuff like that. They will be like, when I was working, I do skip my meals, this and that, I develop ulcer. So
okay, so let me
you won't kind of blend them when they have
yes, I get you, but now let's look at the science behind it. What causes this ulcer? Two things are the basic causes of ulcer. The first one is an infection. Then the second one is the constant use of medication. Okay. That's what scientifically we know that causes ulcer, that has been proven. So the first one I said is an infection by a bacteria. You understand? And the name of that bacteria is H. pylori, Helicobacter pylori. You understand? So what that bacteria does is that it goes to the stomach. You know, the stomach contains what they call an acid.
Yeah.
There's an acid in the stomach. So what that bacteria does, it goes to the stomach, and sometimes you ask yourself, since there's an acid in my stomach, why don't I get burnt or irritated by that acid? You won't be irritated by the acid because the acid is the stomach is covered by a mucosal lining. You understand? It's like a thighs that covers the inner floor. So anything that is on top of the thighs will not affect the inner floor. You understand? So that is what the mucosal lining is. So it protects the stomach from that acid. But you see this H. pylori, it thrives well in acidic environment. So any environment that is acidic, you will see that Helicobacter pylori. So when it gets to the stomach, what does it do? It degrades, it eats that mucosal lining, it scatters or burrows into that thigh and break it. You understand? So when it breaks it, the mucosal lining is now what? It's now open. You now get a wound. You understand? I remember there's an acid there. The integrity of that stomach now has now been compromised. Now that acid can easily go inside that inner lining. That is how you feel that pain that you call ulcer.
Okay.
That is the first causes of ulcer. So ulcer is caused basically primarily by what? A bacteria. You understand? And it's gotten, but we are going to look at how you can get that H. pylori very soon.
Yeah.
Now the second cause is use of NSAIDs. There's what they call NSAID, non-steroidal inflammatory drugs. You understand? NSAIDs. So examples of these NSAID, they mostly call them pain relievers. Like you might have heard about diclofenac, ibuprofen. You understand? Those times when you have all these joint pain, you understand? You just go and buy diclofenac. There are some people that misuse NSAIDs. They take these NSAIDs continuously. You understand? So what that NSAID does, it can damage the mucosal lining of the stomach, exposing that person to what they call what? Ulcer. So these are the two basic ways anybody can get ulcer. There's no that I heard there was a place I went to and someone was saying beans can cause ulcer. I was just laughing, and the person was even like very serious about it, that beans can cause ulcer, and they mentioned a lot of things that can cause ulcer. But please, that is a misinformation and a misconception.
All right.
Okay. Beans cannot cause ulcer. Banana or whatever cannot cause ulcer. Not eating food cannot give you ulcer. You understand? So that is.
Okay, I want to come to Mr. Amah.T.Amah. Mr. Amah.T.Amah, I don't know if you've been following the conversation so far. So do you have any question you have to ask our doctor?
No. The question here is basically, when he was talking, I understand he was speaking based on medical aspect. And Nigeria we live in is a multi-complicated society where everybody think he or she knows pretty much everything, even when you don't know much. So everybody has now become an expert in every field. So that's now boiled down to this misconception. So sometimes we look at the social dimension of this belief system, or even cultural or traditional belief system to most of our health conditions. So that most times what we actually go through in terms of our health status do not come out to be the same. Because this boils down to erroneous way of knowing. Because many people, it has been generally accepted that hunger causes ulcer, and because of that,
before that, I used to accept, whether I believed in that.
So now, whether it is scientifically proven or not, but this is the erroneous way of knowing. Or people in authority have said, don't do this, not because it has been scientifically or empirically proven that this is the actual cause of the problem. So they now begin to generalize it. So that's another social dimension of the belief to what causes ulcer. This is where we need to engage people, create an enormous enlightenment for them to come to understand that when you feel a kind of hotness in your abdomen, instead of you generalizing it, instead of you concluding in your small tiny circle, you visit the hospital. so that they will examine your condition and check what is actually wrong with you. Because I've had issues about people I've seen, and I have directed them to go to hospital. Now they have gone to, this is a typical question in our traditional Igbo society, where some people will be sick or having pain. Instead of rushing to the hospital, they have concluded that these people don't come for me, or they won't buy me. Understand?
This must be ulcer.
It's not even ulcer either. Some I have seen people that actually were undergoing this ulcer issue. But instead of them going through the medical route, they concluded that village people have come. You understand? So it is another wrong dimension of knowing, and it boils down to our belief system. Why the medical doctor here is outlining the actual effect, he was actually reshaping and redirecting our understanding to know that this is the actual cause of ulcer. And in a case of where there is issues like that people should do well to consult a medical expert, thereby enabling them to ascertain what is actually wrong with them, instead of concluding one that hunger causes ulcer, coke causes ulcer, banana, beans, and all what have you. So this has become an erroneous way of knowing, because over time it has been generalized. And this time we just put an end to that and put things straight the way it should be.
All right. I want to ask a question based on what you said. What you just said. I want to throw a question to Dr. Victor.
Yeah, okay.
Dr. Victor, is there anything someone can consume that will cause ulcer? Apart from these two things which you mentioned, apart from medications, there are some certain medication one would take that will trigger ulcer. Apart from that, are there anything, maybe food, someone can consume that may trigger ulcer?
Okay, thank you so much for that wonderful question. You see, for you to take any substance, and maybe after taking that substance, you begin to feel pain, or if you begin to have this heartburn, you understand? Firstly, there are many conditions that resembles ulcer. You know, there are some people that might be having, there's a condition they call it GERD, gastroesophageal reflux. You understand? Is when the acid content in the stomach goes up, it can cause heartburn. You understand? There's some people who tell that after eating some food, they feel some chest burn. You understand? So it might be that. It might not even be ulcer. You get? But for you to maybe drink something or eat something, and you begin to have this maybe pain in your abdomen, your upper abdomen. You understand? That particular food or drink you took is not actually the causative agent of that ulcer. What that drink is doing, or what that food is doing, is worsening the symptom of that ulcer. It simply means that person has already had ulcer before.
Oh, okay.
So you not taking spicy food. If you have ulcer before, untreated ulcer, you do not treat it. You take spicy food, you drink Coke. Coke contains caffeine. You understand? All this can worsen the symptom of that particular ulcer. So for any food to worsen someone's ulcer, it simply means that person already has an untreated ulcer. Ulcer that has not been treated before.
So you are trying to say if you don't have any history of ulcer,
if you don't have any history of ulcer, there's no
apart from taking some painkillers that can trigger ulcer.
It's just normal food.
Normal food. No normal food can trigger an
ulcer. So whenever you take any food and maybe you are kind of feeling pain, because there are some other conditions that you might be having, but it's not what ulcer. I made mention you can have inflammation of the stomach, gastritis. You can have GERD, as I said.
I come to you, Doc. Having laid this background analysis on what ulcer simply means, the causative agent, and the belief system of many Nigerians, can ulcer be treated?
That's a wonderful question. Ulcer can be treated, but do you know why?
Because people have this misconception that once you have ulcer, it can never be treated.
It's a big lie. Ulcer can be treated, but the problem with Nigeria is that there was something you said that when someone has ulcer someone thinks he has ulcer, maybe someone presents with an upper abdominal pain. You understand? The first thing that will come to that person's mind is that it looks as if I have ulcer. The person might the first thing that will come to that person's mind is to go to a chemist shop. And you will say, okay, you go to the chemist, all these patent chemists, and you tell them, okay, you'll be the one to tell them to give yourself diagnosis. You already diagnose yourself that you have ulcer. You didn't go to the hospital. Then the chemist, they might give you some drug formulation and say you should take. Some of these chemist people, they are not experts. Okay. You understand? Because normally doctors are the ones that prescribe drugs, medications for you to take, not chemists. So what you're supposed to do initially is for you to go to the hospital and meet a doctor, and they will give you a treatment plan. So if you meet people who are not experts, there is no way that ulcer will be cured. Because an expert is always an expert.
Yeah. Let's say you meet an expert.
So if you meet an expert and yet the ulcer is still there, go and check that particular patient. You see that they are not compliant with their medication. Because on a normal, when you are giving the drug, they call it a triple therapy. When you are giving this triple therapy, you are expected to take that drug for 10 to 14 days. Do you understand? You take it from 10 to 14 days. When the because it's a bacteria and they give you antibiotic and some proton pump inhibitors as well. So you take it for 10 to 14 days straight up. Then after 10 to 14 days, you will now give the stomach some time to heal and the duodenum some time to heal. So you will give the duodenum like 4 weeks. You give the stomach like 6 to 8 weeks to heal. You see, they have protocols, they have procedures. But how many of us today can follow these particular protocols?
I'm talking about following the protocols. So when you are giving that medication, are there any advice of you shouldn't consume this? This is what to eat and this is what not to eat. Stuff like that.
A patient that has ulcer, the doctor will tell you that if you take spicy food, it will aggravate the pain you're having. Because imagine if you have an open wound there and you put pepper there, what's going to happen? So it's the same thing happening in the stomach. So if you take any food that contains any chemical that will worsen that pain, they will advise you not to take those food. So anybody that complains that whenever he or she eats a food, they get that particular pain, the person has ulcer.
And please, can you enlighten them based on what to eat? Like, call the names.
The thing is a very simple something. Do not eat spicy food too much. Don't take spicy food like pepper and those. Those food that are very spicy, they can trigger that ulcer. It depends on the individual. You understand, for that particular aspect. But it's not that beans can cause the ulcer. Well, maybe you take that beans and that beans is filled with spicy food. It can worsen that particular ulcer.
I've heard someone saying
caffeine.
An ulcer patient cannot eat all this garden egg.
It's not true.
Because I've seen so many cases.
The problem will be that it might be mixture with the garden egg with the there's this they use. Okay. You understand? Thank you. If the garden egg cannot cause a chemical that way, you understand? It's not making sense now. You understand? There should be something that a content inside. Except maybe there's a content in the garden egg that someone has made a new research on. Okay. For now, I don't know about that. If there's just like pepper now, it contains a chemical they call caspacin. So those things can aggravate
a certain pain.
You understand? Those chemicals, they are very active. So when they get to an open wound, they can cause pain there. Same thing applies to caffeine. Caffeine we get in teas, in coke, in coffee. Those chemicals can aggravate. When they get to that wound, they can cause pain there. That's when you feel that particular pain.
But Doc, you see, it's already that we've been talking a lot, and sometimes we are Nigerians. We understand our behavioral culture. So, given the condition of Nigeria health system, that is highly deplorable and already going into extinction. So, do you blame people for rushing to chemists to seek seek help? Because one, the medical bill in this Nigeria is something unaffordable, and even the medical care is as well unaccessibility. So do you blame people, and what must you say in this regard?
Okay, thank you so much for that question. The problem is that whenever we hear the word hospital, we think it's an expensive place. Understand? We fail to understand that we have government hospitals there for us that are subsidized. But the thing is that the truth of the matter is that healthcare is expensive, actually.
Yeah.
You understand? That's why the government should come in and subsidize those health rates. You understand? Now, most times, just like someone presents with ulcer, if you're having an abdominal pain, you can visit a hospital, a government hospital. You might say, okay, there might be shortage of doctors for them to attend to you because of what is happening there. But definitely, because that one is not from the doctor's fault, actually, it's the government fault.
But before I cut you, can ulcer be treated in most primary health care facilities in most rural areas?
If there is a doctor there. That's why I said sometimes when you go to these primary health care center, you hardly find doctors there. Which I will not put the blame on the doctors, because that's the work of the government to make sure that healthcare, mostly our primary health care center, is well equipped with the right personnel that should be there. So if maybe it's just due to the fact that some of our primary health care center, they are not working, but some are working. If it happens that you have a primary health care center that is working and there's a doctor there and the other health personnel that are present, you can go there and go for consultation. If it's a government primary health care center, it's going to be very cheaper there. You pay for your card, you meet consultation with a doctor, and they take history from you. Then when they take history from you, they see your case, then they run some investigation or some tests to really know that that bacteria is there.
It's there.
Before they will not prescribe drug for that particular person. And there's something I really want to make mention of. You know, some people, remember I said something that this ulcer, when you have this ulcer, it is, if you want to treat it, it has a window period. You understand? This is where some people don't get it. You can't proudly come out and tell people that you have ulcer from childhood. You know, you can't come out and tell people proudly you have ulcer from childhood, or that you have ulcer for like 20 years. To me, it's not making sense, because there's a problem somewhere, and you saying it, you are a particular grave danger, because any ulcer that you treat and is still coming back is mostly some gastric ulcer. Is heading towards carcinoma, cancer, gastric cancer. That is why most doctors don't play with cancers that have been treated. It keeps on recurring. The next thing they will do that person.
That's ulcer that have been treated.
It keeps coming back. But most of these people that tell you that they have ulcer from childbirth, they will tell you that they've treated it and it comes back. That's what they
oftentimes I've had people told me that
they've treated it and it's still coming back.
Because you know why I'm saying this? My mom at a certain stage was an ulcer patient. So while growing up, so we could see how we're able to engage it at that time and got it treated. But over 10 to 20 years now, I've not seen my mom complaining of the same thing. So this alone now had to make me start rethinking of that misconception, because oftentimes people will come to say that ulcer is not treated, it is rather managed. I don't know if you get it. So now, but looking at how my mom has never 20 years along the line never complained, because at that time she made us to stop eating pepper. So but along the line she's eating everything now, and so this now made me to start questioning this. So if an ulcer that has been treated keeps coming back, so what could be the cause?
Yes, that's a good question. You remember the first thing I said, if this ulcer is not treated properly or the patient involved misses their dose, that one is coming from the patient. The patient needs to go and complete the dosage. And if you're a patient, you are missing your dosage, it's a very, very bad thing, because you are giving, there's something they call antimicrobial resistance that we should be preaching about now. Maybe in our next podcast we'll need to talk about it.
Antimicrobial resistance. Throw a more kind of enlightenment on this before we forge ahead.
Yeah, it's just like most times 80% of Nigerians, whenever they have fever, headache, is malaria and typhoid. So when they say malaria and typhoid, they go to the chemist store. I have malaria and typhoid. The chemist man or woman will just give mixture of antibiotics without running any sensitivity culture test to know, and the person will just take the antibiotics. You don't even know the type of bacteria that is there. You just take the antibiotics and drink. Now what happens is that if you take the antibiotics, and most Nigerians they don't complete their dosage of antibiotic.
They
will skip it. They might take this for 5 days. You see someone taking it for 2
or 3 days.
When you take it for 2 days and you don't complete the dosage, it means you're not going to kill that bacteria. The bacteria is still there. So since you only take, it's just like, let me explain it now. When we're in primary school, for instance, teacher used to flog us. There are sometimes teacher will give us, we're so scared of cane. But it got to a point, we're no longer scared of cane because we are now used to it. Yes. So when you are taking this antibiotic, you didn't complete the dose. You take maybe just twice in that part in this week. They think you should take this amount for this week and take this amount for this week. You only take 2 doses. That bacteria now will develop a mechanism so that drug you are using for it will not work on it. Yeah. If it is won't you develop a mechanism?
A survival mechanism.
Yes, you understand. So it will develop that survival mechanism so that drug you are using will no longer have effect on it. So for that particular cause now, you take that same antibiotic, the disease is still there. The typhoid is still there. You cannot kill that bacteria. That is antimicrobial resistance. And that is why there are some people, if you like prescribe 100 antibiotics for them, it will not work in their body because they've abused antibiotics. And it's very, very bad. It's something like if you go anywhere, you are trying to enlighten people about. It's not any little fever you have or anything that happens to you. The first thing you go and do is to take antibiotic. It's so wrong. There are some people, if they run sensitivity tests for them, because there's a test they call sensitivity to know the type of drug they will use for you. You understand? Because they will check those drug you've used before, that antibiotic bacteria that is there. So they will know the drug to use for you. You see the sensitivity test. There's no drug that can work for that particular person.
That's very bad.
You understand?
Back to what we are saying on ulcer patient trying to.
So this ulcer patient, when they don't take their medications very well, the ulcer will still be there. You understand? Ulcer is very easy to treat. Thank God we have a witness here that can attest to the fact that when they treated the mother's ulcer, it disappeared. So anybody that is telling you that ulcer cannot be treated is a big lie. If you follow the complete regimen by your doctor, you will be cured. But if after following the regimen judiciously, you did not miss any dosage, and you are still coming back with ulcer, the patient is vomiting, the patient is reducing in weight, is losing weight loss, and the patient is passing out a bloody stool, like black stool, you need to be alert. They report to the hospital, and there's a test they are going to run for that particular patient. They call it upper gastrointestinal endoscopy, upper GI endoscopy.
This one a big
medical term.
Yes, this is the gold standard for diagnosis and confirmation of ulcer. There are some professors who tell you that if you've not gone for endoscopy, how do you know you have ulcer? You must go for that endoscopy to check if you have ulcer. So because some people, they might be having gastritis and they think it's
call it ulcer.
So some doctor tell you, let's go for endoscopy if they see maybe your condition is getting very, very worse.
But doc, are there various types of ulcer or?
Yes. In the introduction, I made mention of it that the general name is called peptic ulcer.
Okay.
So we have the gastric ulcer and we have the duodenal ulcer. Okay. The gastric ulcer is ulcer in the stomach. Okay. The duodenal ulcer is ulcer in the small intestine, specifically the duodenum.
Okay. Now, can lifestyle causes ulcer?
Lifestyle cannot cause you ulcer, but lifestyle can aggravate ulcer.
Okay.
You understand? Though there are some studies that will tell you that something like smoking, alcohol intake, all these things can irritate the stomach.
Yes.
You understand? If you someone that smokes, that drinks alcohol, you understand, they can irritate the stomach. And if maybe you are someone that already has ulcer before, it will continue to be there. I don't know if you understand.
And the more it stays there, the more
it becomes very, very dangerous. You understand? Any ulcer that stays for a very long time, because that endoscopy, what they do, they will insert a camera into the person's stomach and view it. You will be seeing it with your eyes. You will be seeing the ulcer. You will know if it has progressed to cancer or not. Because that is what some people don't know. So if you are watching this video, please, and you've treated your ulcer, it keeps coming back. Please go and report to the hospital so that you save your life. Cancer is not something you want to deal with. So you go and see a doctor. Doctor will run an investigation and test with you. Don't tell me that you've done a culture test or a stool culture test that they said they've seen the bacteria inside, go and do an endoscopy. You meet a doctor, they'll do an endoscopy for you.
Okay. I want to ask, are there early symptoms of ulcer? Like anybody having these symptoms? Because what most people have in mind is once they start feeling abdominal pain, they will say it must be ulcer. They will start taking. Apart from that, are there other symptoms?
The basic symptoms of the ulcer is that pain that surrounds the upper abdomen. You understand? And sometimes they feel some people think that they have heartburn or chest burn. Some will just say that maybe like some people now that has gastric ulcer, whenever they eat food, the pain will be there. That's when the pain starts. And people tell whenever I eat this food, that's when this pain begins. You understand?
Why I ask this question is because I have a friend of mine that keeps complaining, like he will kind of have a leg pain, like somewhere here, close to the waist. It will be like his ulcer, like because he said he has a ulcer.
It's not. So that's not. It might be another ailment. That's not how ulcer works. It has no connection, except maybe it's not getting to another aspect. The person should report to the hospital so they will examine the person and know what to do. And secondly, someone might want to ask, this bacteria I've been mentioning, how do people get it?
That's another question.
How do people get it? So this H. pylori can be gotten from this process. Number one, there's something people call it the fecal oral route. Now, let's take for instance, if maybe I have ulcer, for instance, and the bacteria is in my stomach. Definitely, when I eat my food and my food is being digested, I will pass it out as feces. So the bacteria is in the what? In the feces.
Feces, yes.
So when the bacteria is in the feces, it goes to the soil. You understand? And most of us, we sometimes happen to have our body in contact with the soil.
Yes.
And even the soil sometimes have a contact with the water we used to bathe.
Yeah.
You understand? So from there, when that particular content gets in touch, we will call it fecal, oral, fecal, feces, oral, mouth. Those water we use it to cook. Sometimes we don't cook our food properly. Some people even drink it. That is why this bacteria, many people get it from childhood. But you might get the bacteria, you will not get the symptoms because people differ. But some people that will get the bacteria to be there 9 years, but nothing is going to happen to them. While there are some, immediately it enters them to start causing destruction. So that is number one way you can get that particular bacteria. Another one is through oral routes. Like for those that love kissing, if you kiss someone that has Helicobacter pylori through saliva, you can also get the bacteria. Yes. So you can get it through that particular mode. So improper hygiene, if you don't have good hygiene, drink dirty water, those bacteria can be there. Or there are some people that do it outside where they don't maintain proper hygiene while they are cooking their food. You understand? Those food might be contaminated with what? With that bacteria. So bacteria is basically what causes ulcer. And the use of medications like NSAIDs. Any other thing they tell you is not true, except maybe a new research has come out to tell us otherwise. Yeah.
So, moving forward now, how do we now correct this general misconception?
Yes, that is why such a podcast like this should be created.
Okay.
Awareness ground should be created. People should be sensitized and enlightened. Because if definitely hunger is what causes ulcer, I think many people would have even died in Nigeria.
Especially the condition Nigeria finds itself now.
A lot of people would have died because before you know it would have progressed to carcinoma itself.
But all that attribute cancer to poison, is that true?
Poison, in medical term, if when you say food poisoning, it can mean a lot of things.
Yes.
So if maybe someone has food poisoning, someone that has diarrhea, that had diarrhea, it might be due to food poisoning. Maybe you took a food
and they attributed that.
No. The food poisoning itself can be the H. pylori. Okay. If you take a food that is contaminated with H. pylori, when they say food poisoning, it does not mean someone
drink
inserted like what they tell us in Nollywood.
Yes.
Food poisoning. When we bring one paper and what's that woman's name in Nollywood that used to poison? Yes, and put one white powder food poisoning, if a food is contaminated with a bacteria, virus, or anything, that's food poisoning, and they can irritate the stomach.
And it doesn't necessarily mean those powdered.
You understand?
So this thing has preoccupied people's mindset, and medically, just offset this so that people will be able to understand that this is the medical condition of this situation, and the best way for us to engage and deal with it.
Yes. So whenever you as if you and I are feeling us, when you are presented with these symptoms we made mention of, you think you're having stomach pain, or maybe you think you are bloating, or you feel discomfort whenever you are eating the food you're eating, you feel the food that they are not digesting, but there is something wrong with your stomach, the first thing you should do is to visit the hospital.
Okay.
Visit the hospital. That is the first place to go to. There are many government hospitals out there that you can visit. You understand? So don't have this mentality that hospital is a place that is very, very expensive, because that's the problem with Nigeria. They will tell you that UNTH is not a good hospital. You understand? But most of the cases that they present there are chronic cases. They are not even cases that are early. They are long-standing cases. And when you present an advanced case, there's nothing anybody can do. That is the problem with Nigeria. They will keep. You have an issue, they'll keep petting it. Okay, you now that has an ulcer,
even visiting quack.
Yeah, what have you been doing all this while? Have you taken time to go to seek for proper expert management of that particular ulcer? And if you do that, I told you 10 to 14 days is what you need.
For it to
10 to 14 days, that's when you take the drug. Then 4 weeks, 6 to 8 weeks, you are good to go.
I know people would want to, given Nigeria this opportunity, Doc, people might want to go, but they tend to have this phobia about the financial.
Yeah, they should go first. They've not gone. They want to,
because yes, they want to. That's one thing that scare people from visiting the hospital. Finance.
Yeah, it's
understand.
Finance. It's true.
So
I don't have money.
I don't have money. Because even if you look at it now, there are many people that are undergoing this critical case we are talking about now, but they have not visited the hospital. So it's not within the jurisdiction of the health facilities to do anything. That's why we are appealing to both state and the federal government for them to do something and improve the healthcare system in Nigeria.
All right, Dr. Victor, I want to ask you a question. I want you to talk about stress and ulcer. Do stress have any impact to play alongside ulcer?
Developing ulcer?
Yes. Thank you so much for that question. When we talk about stress, we can categorize stress into two parts. We have what they call physiological stress. Physiological stress, is not the emotional stress we think of. Physiological stress can be, for instance, a burn, a trauma to the stomach. When maybe the stomach is burnt, maybe taking a hot substance or something. In medicine, when we say a cell is stressed, it means the cell is going through a lot. Let me use that language. Okay. It's going through a lot, and a lot there is that cell as the cell now has, maybe it has been burnt, it has undergone some chemical destruction or changes occurring in that particular cell. But when you talk about those stress, like emotional stress and all those things, they don't cause ulcer.
Physical stress and
when someone say after reading book for like 20 hours or going to work,
walking,
it does not. It can only worsen the ulcer that you already have. You understand? Not that it causes it directly. It's not the primary cause.
Okay. What you now explain here is a physiological
stress. That physiological stress that can cause ulcer. Yes, physiological stress can cause ulcer, but those normal physical activity we do. I've already given us the pathophysiology of how the ulcer comes back from the bacteria and the medication use NSAID.
There are some people that, please, I want you to talk to them. There are some people that believe in I don't want to go to the hospital. I rather go to church. Let my pastor for me. So they will keep it to themselves, going to church.
Because you see somebody dying, and instead of running a test, they will rush to the hospital. They will rush to church. Or even Babalawo.
Yes.
And Babalawo will tell them that,
or even take a native medicine.
Not just native medicine. Some will even go ahead drinking Goya oil. calling it anointed oil.
What you are saying is very, very important. This is a very, very crucial aspect, you understand, in healing process. You know, what people don't understand is ignorance, actually. No one is saying you should not pray. Do you understand? No one is saying you should not pray. No one is saying you should not hold very fast to what you believe. You understand? You are right. That is your right.
That's
you
your
understand?
right.
You understand? But then we should have wisdom. Even in the Bible, there are some places we can cite for you where even the apostles, they made use of medicine. These are people that can even do miracles, but they made use of herbs and medicines to take care of themselves. You understand?
Yeah.
So heaven help those who help themselves. While you are doing your own part, praying to God. God, if God wants to work, He's going to work through people. You understand? So He works through people, and He's going to work through medical doctors as well, through health personnel to help you. While the health personnel are doing their own, God is also
working,
doing their own. They said, how do they say? Give to Caesar what belongs to Caesar. You understand? As the medical personnel are doing their own job, you as well should be doing yours by praying, and they go together simultaneously. Even the pastors you are meeting that they should pray for you, they go to they receive one of the best medical
because
care.
These pastors, I come in here, you know, these pastors are, I don't know, they will always tell me, my God will heal you, but when they have health,
just like this, when
they have health situation, they will run to overseas. So what do you tell people? What do you tell people here, especially those who are strong, rooted in faith that my God can do this? There is nothing, I believe, there's nothing God cannot do to solve human problems. But in a case where you have critical issue like this ulcer we've been talking about, and it's very critical case, and it can take someone's life, and you are in the church praying, that instead of running to hospital, you go and say, so what do you tell people all across faiths, including those that practice even traditional? Because I've seen cases where they don't, if you're telling them go to the hospital, they'll rather go to native doctor's house. And look at the implication. The native doctor will not tell them, as we are speaking now, will tell them that they have poisoned you, or village people have come to kill, and they will be giving them substances that will even worsen their health condition. So I want you to lively speak to our audience so that we carry this message all across every nook and crannies of the society.
My brothers and sisters watching, please, if you really want to live, if you know you want to live, you want to enjoy your life, if you present with any of these symptoms, with any of this condition, please visit the hospital. Please visit the hospital if you really want to live. But if you know you don't want to live, that one is a different game. But I want you to live. You understand? I want you to live. I want you to enjoy this life. Ulcer is a condition that can be salvaged. You understand? Medically. And we've seen cases, we've seen witnesses, we've seen testimonies of people who have gone to the hospital and they've been cured of ulcer. You understand? Make sure you go to the hospital. That should be the first thing you should do. Instead of looking for herbal medication that will even worsen your ailment. Herbal medication that does not have dosage. You don't even know what is the content in that herbal medicine. You understand? You don't know the content of that particular chemicals in it. So please visit the hospital. Ignorance is what makes people say it's my faith, it's my belief. It's ignorance, because even the pastor that you believe knows better than you goes to the hospital. Some even fly abroad, go to India, go to US, to the best facility and receive the medical care. And you that is a member, you know, you are being brainwashed, you are ignorant, and if you don't do what is necessary of you, you just die like a chicken. Okay. You understand? So if you really want to live, you know what to do. Visit the hospital. It can be cured.
I've seen in most cases where an ulcer patient taking milk, stuff like that. I don't know, does it help? I know
milk can kind of resolve. Remember, if someone has ulcer, most of them go and take milk. Milk can resolve it temporarily. You understand? Just give you temporary relief. But in the long run,
it will come up again.
That milk will even worsen the situation.
Okay, what in a situation now? In a situation whereby an ulcer patient, maybe you have ulcer you don't know, or maybe you have ulcer you know, and there are some certain points where the ulcer will kind of hit you at the moment, like whereby you'll be weak or you'll be down. So what are the basic steps, like let's just say a first aid, before the person can visit the hospital?
Okay, when maybe someone gets, there's an ulcer that is not that seed when it comes. You understand? So the first thing you should do, you should avoid. Don't take any drug. Just do. There's something called conservative management. You should avoid taking food that can trigger or that can worsen that ulcer. Like spicy food, the caffeine we made mention of. So stop taking all those food that you know that when you take this, it's going to worsen that.
So what of that moment is hurting you? What will you take?
That moment
to become.
Most times,
milk.
But I'm not going to advise you to take milk. It is not the best thing. Avoid taking those things but the reason why it's hurting in the first place is you've triggered it. You understand? Most times, if it is maybe a gastric ulcer, whenever you eat food, it can start again. You understand? That is why when you have that particular issue, quickly, if it is the next day, run to the hospital so that they can prescribe medications for you. And I told you, they give you that medications within 2 months. You are good to go if you follow the medications.
Yes, and it's true. Because my nephew, his own is just 1 week. Because 1 week he has been down until they called me and I had to redirect them to a hospital in Nsukka. So 1 week of taking that medication. Till this day, the young man is bubbling.
That's very good.
Enjoying life
and has never complained of anything.
Very good. Please, if your ulcer is still there, 15 years, 16 years, but it's not a good thing.
There is another misconception that is it hereditary? Does it run genetically?
It's not actually hereditary because we've already seen the causative.
Because people will all tell us that my family is have a history of ulcer.
The only thing is that there's a medical condition. I don't want to call the name. There's a medical condition that happens to people. It's like a medical condition, genetically condition or something. It makes people produce excessive acid. You understand? There's an acid in the stomach. So there's a condition that some people will have. It will lead them to produce too much acid. And when there's too much acid in their stomach, it will cause that ulcer. Maybe that was what that person is.
So, but in real context, ulcer is not genetically.
It's not inherited. The only thing we know is that people with blood group O, they are at a high risk of having ulcer. Anybody with blood group O, if you have blood group O, you are more
negative or positive.
Yes, you are susceptible to, or you are vulnerable to having ulcer. So if maybe you are not careful, if that bacteria enters your stomach, it can easily destroy the mucosal lining. That's someone that is blood group A.
Because I like this side of clarification that ulcer is not hereditary. Because sometimes they tell us that my family have a history of ulcer, so I am bound to have it too.
That means your family is drinking a lot of H. pylori all the time now. If it occurs in a family, the reason why it's like that, in a close, people that live closely together, definitely they will get ulcer because they are eating from the same pot,
consuming the
same food, the same water. So if maybe one is infected, the other person can have it. I don't know if you understand.
In a situation, family history is this, that even when this generation outlive themselves, another generation coming will develop ulcer. And when you ask the person, they will now tell you that my grandfather or grandmom had an ulcer. So
if you trace it well, it will still connect back to what we are saying.
Okay.
These people, I don't understand. If you trace it very well, it will still come back. Because they are relatives. They see. Sometimes we do see our relatives now. Our relatives come to stay with us. Sometimes 1 month, 2 months, 3 months. We go to our villages. You understand? We do things together. So from there, we can easily.
So, Doc, wrapping up this, you've made us to understand that hunger, does not cause ulcer.
Anybody that tastes that thing is not true.
Stress
is not true.
Does not cause ulcer. Ulcer is not hereditary. Ulcer can be treated.
Yes.
So
within 14 days.
Within 14 days. And I can testify that my nephew got treated in just 1 week and he's fine currently as I speak to you. So he's fine. So this is what we are putting out, that all these misconceptions be cleared. And the general of this outstanding of this misconception is hunger. And you have fed Doc clarifying this whole thing. So don't attribute your ulcer status to hunger. Rather, visit hospital and check yourself out.
All right. Okay. Before we conclude for the day, I want to, Dr. Victor, your final thoughts.
Yeah, I will still want to buttress on the point of people that says they've had ulcer for like 10 years, 15 years. I know I'm saying this because there is a high rate of cancers now in Nigeria as well.
I guess we have to talk about cancer on our next.
There's a high rate of prevalence of cancer. If you even come online, you go to Oculara's page, you see people with cancers and the rest coming out for head and the rest. So please, if your ulcer, you've treated ulcer, is still coming back, don't neglect that aspect too. It's very, very dangerous. It's progressing towards something. It's progressing towards gastric carcinoma. Anytime you visit the hospital and doctor asks, okay, you've treated this ulcer, it keeps on coming back, 5 years, 6 years, 7 years, not a good thing. It's not something you should even come out and be saying out in the public that using it. Some people use it as a guy.
Some people will even adopt it.
That's my lifestyle. In my life, I have ulcer.
Let me live with
it. No, that's ignorance.
Ulcer
you can get rid of it.
You can get rid of it if you are serious. If you are very, very serious, you want to follow the guidelines. Yes, follow medical procedures. Follow medical procedures. 10 to 14 days, you take your antibiotics they prescribe to you, and after that, you allow your stomach to heal. Your stomach can heal for 6 to 8 weeks. Your duodenum can heal for 4 weeks, and within 2 months, you are back and you are bouncing. You understand?
And the rate of ulcer now is a lot. Like it's too much.
It's too much. Yeah, it's too much.
No family you go now,
and they are attributing it to hunger.
Yes,
it might not even be ulcer. It might be something like gastritis. It might be GERD. It might not even be ulcer.
It's just that we have this
mentally any irritation in the stomach, we attribute it to ulcer. Someone might be having appendicitis. If you tell you that it is ulcer,
yes,
you understand. So these are different. By the time you take history from this patient and you do investigation and tests, you will not even say, this thing is not even ulcer. This is not ulcer. You understand? Because there are some tests they will do for the person. They can do the person some culture test to check if the bacteria is there or not before they will now prescribe medication.
Okay, thank you so much, Dr. Victor and Mr. Amah.T.Amah. I really, it's good to have you guys here in the building. So, before we round it up for the day, I want to also remind you, our viewers, viewing us, you have to subscribe to this channel. If you are yet to subscribe, I don't know what you are waiting for. Subscribe and share. Share the link for it to reach to your family member, anybody. You don't know, you might be saving a life. Yeah, because we upload amazing videos here time to time every week on this platform. So do well to subscribe and put on the notification bell. So I remain your humble host, Prince Ewuzie, and we will see you on our next video. Bye for now.
See you.
Amah.T.Amah is saying,
stay healthy. Stay healthy.
Live healthy.
Someone will say, be strong and healthy.
Yeah.
See you.
You need to be healthy at 21.
Yeah, very, very important.